All right, I'm going to start with the gluteus medius muscle test for the cuboid to see if I need to do pronation protocol. So I'm going to start with my patient and put the leg down and resist, please. All right, that is a grade 4 or less, which is an indicator to start pronation protocol. There's going to be 3 more indicators for pronation protocol, which would be a positive navicular drop test, medial bowing of the Achilles tendon, and a combination of eversion, abduction, and dorsiflexion. So then I would go ahead and start with the navicular. All right, and then I would do the cuboid. All right, and the cuneiforms. Come down in here. All right, and then I'm going to do the met heads. And the talus, taking the medial hand first, dorsiflex. All right, and then I'm going to do the calcaneus. And the phalanges, distraction. All right, and then I'm going to end with the fib head. All right, and so then I'm going to retest the muscle for that. All right, and that is a grade 5, so that means that it worked. All right, so I'm going to do the 3 indicators for supination protocol, which would be a negative navicular drop test, lateral bowing of the Achilles tendon, and a combination of inversion, adduction, and plantar flexion. So then I would start with that, and the difference being the navicular and cuneiforms are together on this one. All right. And then I'm going to do the cuboid, which is the same. All right, and then I'll do the met heads, keeping her leg down here. And then I will do the talus, so I'll bring that up. Lateral hand first this time, dorsiflex. All right, and then the calcaneus, which is also the lateral hand this time. And the phalange distraction, and the fib head. All right, and now I'm going to assess the knee. There are 3 listings that you can have. You can have a lateral condyle, a medial condyle, or a posterior tibia. So in my assessment of this, I'll bring it out, straddle the knee, put my hands in kimbo, and assess for motion, lateral or medial. And if it was going lateral to medial, it would be a medial condyle. If it was going medial to lateral, it would be a lateral condyle. And if it was going both ways, it would be a posterior tibia. Hers is moving medially, so I would have her flip over because that's a medial condyle. And I'm going to do the prone knee flexion technique. So then I would come in, bring her leg past 90 degrees. I'm going to tissue pull medially, and then I'm going to rest. All right, and I'll have my patient flip back over, please. And I'm going to reassess that knee. So I'll bring it out. And there should be no motion either way, and there's not. So that's good. All right, next I'm going to do an anterior femur muscle test. So I will bring her leg up here, and I will have her resist. All right, and that's a grade 4 or less, so that is an indicator to adjust. So then I would do a posterior glide adjustment, bringing her knee up like so, cupping it with my hand, and I'm going to feel for an area of resistance, and I feel it resistant right here, so I'm going to go ahead and adjust. And then I would retest that by bringing it up. Alright, and that's a grade 5, so that's good. Alright, now let's see, the talus typically subluxates mostly anterior and slightly lateral. So in an alternate talus adjustment, I would have my patient, if you could flip over for me, I would have her talus against the end of the table, come in, and adjust. Alright, and if you can flip back over for me. Now I'm going to demonstrate a big toe adjustment. So I will come in with my finger, make a clamp here, and pull. Alright, now I'm going to do a bunion adjustment in which I would just take the patient's foot and slip off a few times, and that should help the bunion. And now I'm going to assess the patella, in which I go ahead and check for motion of the knee laterally, medially, and superior and inferior. Hers is not moving superiorly, so that's the way that it is subluxated. So I would just go ahead and thrust superiorly, and then I would recheck it for motion. And there's motion all 4 ways.